Hello, and welcome to GatherVerse News Unscripted, your home for humanity-centered tech journalism. I'm Lisa Bernard. Thank you so much for joining me. Today, I will be speaking with Sid Desai. Sid is the co-founder and CEO of Novobeing. It is a VR tool that helps address the unmet mental health needs of patients who have long-term hospital stays and also healthcare workers in hospitals. And it's also a tool for the masses, introducing meditation and breath work, as well as cognitive behavioral therapy, among other things, to help with stress management. Sid, thank you so much for joining me.
Thank you so much for having me, Lisa. It's a pleasure to be here.
Pleasure to have you. So I want to start, please, if you would tell us about your background, where you loved tinkering as a kid, combined with your father's health struggles, and how that led you to where you are today with your work.
Yeah, so, kind of going back 20 years, which is a long time ago now, I've always been the kind of guy that likes to take apart stuff, right? So as you mentioned, rightfully, I'm a tinker at heart. And when I was a kid, I used to take these, kind of old rotary phones or television sets and radio sets and just kind of unscrew them and just explore the inner workings of these gadgets. It drove me, like, in my curiosity, like, to understand really how these technologies and how these devices actually worked. How did they produce sound? How did they produce sight, and so on and so forth. My dad was pretty upset a couple of times because I actually bricked a lot of his phones just doing exactly that. So that wasn't a happy moment, but really that curiosity led me down a pathway to then apply that same drive into understanding the inner workings of human lives, right? I was very curious about what makes our humans function the way they do, what makes them think or behave or feel the way they do. And so I started developing this drive to, like, understand human psychology, and devoured a lot of books on the topic about psychology at an earlier age. And then a big event that kind of shook my life was, as you mentioned, my dad's passing due to cancer in 2015. And that event kind of changed the way I looked at my life. I mean, that event really drove me into looking into solutions for people going through a similar journey. And in 2020, I kicked off Rocket VR Health, which is now Novobeing, with that intent that we want to bring more amazing immersive well-being experiences to more and more people out there, especially those who are struggling with their cancer, cancer patients, survivors, and also just the broader audience in general. So that's really what got me started.
So great. So in terms of, let's talk specifics, you have some clinical trials ongoing, if I'm correct, at the Mass General Hospital. You've worked at the University of Calgary, also UPenn, with patients who have cancer, as you've mentioned, and specifically stem cell transplants. These patients have to be isolated for a month at a time. Tell me about that anxiety for those patients and how you had this idea to address that.
Yes, our first partnership was with University of Calgary. We were looking at the use of virtual reality immersion and virtual reality meditations to lower chronic pain, chronic cancer pain, and anxiety in this population. But then soon after, I'm here in Boston, and we kicked off a study with Massachusetts General Hospital. And when I met with the researcher that we're now working with, Dr. Arij Johari, she immediately found value in what we're building, but more importantly, found value in the application of what we're building to a very specific audience, in this case, patients undergoing stem cell transplants. So as you said, these individuals, they go through a pretty intense hospitalization, 30 days, sometimes 40, 50 days, depending on their condition. And they can't really leave that hospital floor just because they're immune compromised. They can't really go outdoors. And a lot of these hospitals don't even have windows for these individuals to view and check out the outside world during their intense hospitalization. So as you can imagine, their distress levels can be extremely high. And these patients develop a lot of mental health disorders, not just anxiety disorders, but also depression and PTSD from these intense hospitalizations. So what we are doing is we're working with the hospital to co-develop an intervention that is completely digital. It's available over virtual reality. And it transports these individuals to beautiful nature-based locations
Mm.
where we not only provide them with relaxation material, but also therapeutic interventions that are clinically proven to reduce anxiety and distress and PTSD. So we're going through that trial right now, and we're super excited to be partnering with them.
So do you have any results yet? Do you have any results with these patients?
So the trial that's ongoing at MGH, we don't have the results yet. We just kicked that off 3 months ago. So we're probably going to have to spend another 4 or 5 months before we have some meaningful data back. But we did get the qualitative results back from our study with the University of Calgary. And the results were just fantastic. Over 90% engagement rates of the protocol of the product that we used in that study. And most patients actually went through the entire 6-week intervention with 90% engagement and adherence rate. So that's kind of pretty positive, which typically a lot of these digital health interventions that are offered over a 2D device, such as a mobile phone, tend to have a lower engagement rates because they tend to get distracted quite easily with other apps on their phones and YouTube and Netflix and Instagram and so on and so forth. But with VR, because it has this capacity to kind of keep your attention focused for the entire duration of the treatment, we're seeing a lot more higher adherence and engagement as a result of that.
And is there somebody, a therapist or somebody that is speaking to them, guiding them? Do they see the person? Is there actual therapy being conducted?
So a lot of what we do is what we call self-administrable therapy. So this is all designed in such a way that they can kind of go through it by themselves. There is no actual live human on the other end of it. A lot of the content is actually pre-recorded and then provided to them in a gamified fashion. So that makes things a lot more interesting and sort of engaging for the participant. But that being said, we are exploring the potential of bringing in a live person at the end of this year. In fact, we already have a beta release out for our app for the consumer version, and we have the capacity to bring up to 6 people in the same virtual space together, where we could potentially engage in therapeutic interventions. So that is exactly the future that we're working toward. And we do envision a world where in the future you might be able to meet your therapist in an immersive environment, and they'll be able to pull up a 3D structure of the human brain, for example, to help you understand certain concepts of the human brain and how it functions, or be able to pull up certain therapeutic games that they might even play with you so that you can understand some of these concepts in a deeper sense. So it's all exciting stuff.
Yes, and I imagine that it could help with costs because therapy is so expensive and so few people can actually have access to top psychiatrists, and also they're very busy. These psychiatrists are overwhelmed. Many don't take new patients.
Yeah.
So it does seem like it is a way to have increase access to people.
Absolutely. Yeah, there were some stats that were published. I think there's the ratio is so skewed that there's over 300 people that are in need of therapy for every one psychologist that could provide services. And this ratio, obviously we have to train more psychologists to get them up to speed, but more importantly, we also need to focus on the engagement. The type of modalities that these psychologists use are phenomenal, but a lot of times they're not as engaging as we would have liked. To give you an example, if I want to help somebody understand the connection between somebody's thoughts, feelings, and behaviors, I can draw a picture for you and you might get that. But if I convert that into a 3D therapeutic game and give you certain scenarios to identify, identify this person's thoughts, feelings, and behaviors, and let's play a game, this information sticks in your brain for a lot longer because it leverages a lot more other neural connections than audio or visual. It also leverages kinesthetic connections in your brain. And that way, the therapy session is not just productive or engaging, but the actual durability of the therapy session is also much better as a result of this.
Yeah, that's so interesting. So you've really studied the brain in so many different aspects, both technologically and also psychiatrically. That's really interesting. You also had mentioned for healthcare workers who are in the hospital. Do you have a trial with them as well?
Yeah. So what's interesting is every hospital that we have approached to, and we presented the use case for patients, the consistent theme that kept on coming up was, hey, do you have something for our providers, our nurse practitioners? We're just, burnout is a real issue. I think the numbers are so bad. There's over 50% of the healthcare practitioners experience burnout, on a continuous basis. And I'm not saying that, VR interventions or mental health interventions are going to fix all aspects of burnout. Burnout is a pretty complex subject, a lot of facets to it. But if we can help alleviate their stress and anxiety as they're going through, and helping patients in a hospital setting, that would be fantastic. So yeah, we are in conversation with a hospital out in Worcester, Massachusetts, called UMass Memorial Health. This was actually the birthplace of MBSR, mindfulness-based stress reduction, was invented by John Kabat-Zinn at this hospital 30 years ago in 1970s. So we're super excited to be working with them. We have a few demo sessions scheduled with about 30 people from UMass Memorial Health next month. So we're super excited to kick off, a potential project with them focusing on healthcare practitioner burnout.
Great. So let's shift to talking about the product that's in MetaQuest and is for the masses, for lack of a better way to describe it, not only for cancer patients or caregivers. And while we talk, we'll show a promotional video of some of the beautiful images that users would see in their headset. So talk to me a little bit about this Novobeing. First of all, tell me about the name of your company. It's a new name. Tell me how you came to it.
Yeah, so my co-founder Nick and I, we were going through a lot of brainstorming about what name would resonate most with people, and we had a few options in mind. But this word being kept on coming up, and it really comes from this framework that I believe John Kabat-Zinn potentially even came up with. It's called the domain of doing and the domain of being. And all of us as a society, we spend so much time in the domain of doing. We're always doing things. We're always going from one thing to another. We're not spending time in the domain of being. So that was the whole idea behind it, that how can we bring the word being into the name? And then the word Novo kind of just, how can we get people to experience a new sense of being? That's where the word Novobeing came from. And yeah, so we just went through a rebrand, and so that our app is indeed live. And one of the reasons why we also developed this consumer-facing app is because on a consistent basis, we kept on getting requests from people all around that, hey, this is great. I love all the visuals and everything that you guys are doing. Can I use it? I'm not a cancer survivor. I'm not a caregiver, but I want to use it because I'm just going through a lot of, a stressful time. Do you have something for me? And the reality is, stress affects everybody, right? There's close to, 50 million people in the US that perpetually exhibit, chronic stress, and it's a huge issue. Mm-hmm. So we believe that, by having these modalities available through consumer headsets like the MetaQuest 2 and now the MetaQuest 3 that just came out today, we'll get Novobeing in the hands of more people and give them access to immersive well-being sessions that are just so much engaging and so beautiful that it will help them potentially lower their stress and anxiety.
It does seem to me that it is a bit of a crowded space, though. I mean, I know of Trip, 360 Relaxation, Supernatural, Flow VR. How do you position yourselves differently, or what do you think is different about Novobeing?
Yes, so I think we're focusing pretty heavily on the interactivity part of it and the personalization part of it. So we have a mood and a stress meter within our app. And so a lot of the content that we're going to be developing will be customized and personalized specifically to you and your needs. And as you can see from this video, a lot of experiences that we're developing are heavily interactive. And the reason we're doing that is because when you are developing in VR for the modality, you got to take advantage of that modality. You can't put a simple video file, a 360 video file, and a simple audio meditation and expect people to actually meditate and practice breath work without making it interactive. So that's what our value differentiator is. Some of these other apps you mentioned are wonderful apps. I actually use some of them from time to time as well. But the way we are positioning ourselves is that we want to make things more interactive. We're also launching our group session feature. So you'll be able to actually experience a live meditation and a live breathwork workshop in a group setting with other participants. And what's interesting about our approach is we're learning a lot from our clinical trials that we have running at these hospitals, and we're bringing in a lot of that clinical background and expertise and feeding that into our consumer products. So we believe that it'll make for a better, more durable product.
Just quickly describe what those hands were doing. What are the hands in the video?
Yeah, so one of the things that we figured out is that we don't have to use controllers anymore. So most Quest headsets these days support hand tracking. So you don't even have to have your controllers in your hand. And in that particular example, one of the meditations that we have is a meditation where you're actually building your own constellations in the air. And you're able to do that by connecting these different stars with your hands, and then the constellation pops up in the night sky. That's one of them. The other one is, you're holding your hand out in front of you, just like so, and then this magical orb and comes and lands in your hand, and it kind of charges up your hand a little bit, and you bring that closer to your heart. So we're kind of taking a lot of these embodiment practices that typically people do in their day-to-day meditation practice, but we're making it more engaging and immersive, so that it resonates with users in a much better way.
Well, thank you. Thank you so much, Sid, for being with us today and showing us the work you're working on. I really appreciate it.
Of course, Lisa, thank you so much for having us, and congratulations on all the wonderful stuff that you're doing at GatherVerse. So.
Thank you so much. Thank you.
All right.
Appreciate it. And to all of you out there, if you happen to be at the AWE conference tomorrow, come say hello. I'll be facilitating a fireside chat with Christopher Lafayette, the founder of GatherVerse and GatherVerse News. He's an emergent technologist and a humanitarian, and you won't want to miss our discussion about the importance of striking a balance between technological advances and human values. Come see us at 12:45 Pacific time tomorrow. And at the same time, right here tomorrow, Jade Hernandez will be hosting GatherVerse News Unscripted. Jade will have a discussion with Jill Tucker, and they'll talk about how educators are handling the emergence of ChatGPT. Jill is a longtime education reporter in California, and she's dug into why some school districts are banning ChatGPT while others are using it to help rewrite curriculum. That's tomorrow at noon Pacific time, right here on GatherVerse. Thank you so much for joining me today. Hope you have a great day.